our new book, the APA publishing textbook of anxiety, trauma, and OCD-related disorders. So this is the third edition, so we must be doing something right because it is a third edition. It's having an impact on the field. And we felt that it was time for a new edition because there's been a lot of developments in the field. So both in terms of our understanding of the anxiety disorders, so new data with regards to brain circuitry, for example, and genetics. There's been a huge change, I guess, in terms of the classification system for the anxiety disorders as well. And with the publication of DSM-5, you know, one of the big changes was that the trauma-related disorders were sort of highlighted as a separate chapter within DSM-5, and the obsessive-compulsive related disorders was carved out and highlighted as a separate chapter or a section now. So we have the, you know, the fear and stress circuitry, you know, classic anxiety disorders, the trauma and stress related disorders, and the OCD and related disorders. So that's important. And then there have been a number of new developments in terms of treatment as well. And, you know, this book can bring some of the new developments in terms of practical treatments to bear for clinicians and for researchers as well. And, you know, another important development was that we brought Dr. Naomi Simon into the project, and she's a superstar in the anxiety disorders and brings unique expertise and fills out our portfolio. Then finally, the point that I also wanted to mention is that we wanted to dedicate this book to Donald Klein, who was you know, a giant in the field and had a big impact in terms of our own personal careers as a mentor and a major impact on the field as a whole as well. And we wanted to dedicate this to him as well. Naomi?
Yeah, thank you. So it's my honor to take on the role working with really amazing editorial team and an incredible group of expert authors who either updated their chapters or redid new chapters covering really everything in the clinical and clinical research space around anxiety disorders, OCD, and post-traumatic stress disorders, all in one comprehensive textbook. And another thing which I was also involved with my colleagues was making sure we addressed what's now a new diagnosis in both ICD-11 and DSM-5 of prolonged grief disorder, which wasn't in the prior manual. But I think we made special efforts to make sure that this book could be useful to clinicians as well as to researchers. So you would have one place where there was a comprehensive review of everything from psychotherapies, pharmacotherapies, the pathophysiology of the conditions, and what is going on in kind of cutting edge in research in these conditions. And I think that's what the user will find in this textbook.
Right, and I guess I would just like to highlight what was said is that, you know, not only do we focus on specific disorders and the clusters of those related conditions and cutting edge new science, but that we show how these sort of new findings have been incorporated into new treatment developments as well. And, you know, that can be an invaluable resource to residents, to practicing clinicians, psychologists, social workers, educators, as well as people who are established in the field who want to sharpen their clinical skills and also strengthen their research approaches to these different conditions as well.
Yeah, and I think building on that as part of kind of being up to date, we wanted to include information about how to think transdiagnostically, which has been a big effort in the National Institute of Mental Health to think about things like the RDoC criteria, which are how do we understand the core phenomenology of these conditions and how do we think about the comorbidity. So we have special sections in the book that addresses some of those issues as well.
Right, and another development is we also highlight, you know, how these conditions present in the elderly and also in childhood populations as well. So they're sort of unique populations. And we do have some work showing how social and cultural factors can influence the expression of these symptoms, for example, what some of the economic consequences are, and also the role of advocacy groups as well in this area.
I think that's right. So it's overall quite a comprehensive book covering all of the clinically relevant and kind of cutting edge research approaches across anxiety, traumatic stress, loss, and OCD.
Right. And I guess I would just highlight that, we really do have the who's who in the field. So both outstanding researchers and clinicians, and we're really proud to have them all contribute to this third edition.